Well, the concern about the creation of a public option, which is a government-run healthcare plan, is that it will rapidly force out private insurance from the market. It will be underpriced compared to what the private insurers can pay, and since we have an employer-based healthcare system, the employers will choose the least expensive option, which will be the public plan. So very quickly, you'll see patients being pushed into that public plan by their employers. And the Lavine group has shown that it will be millions of people will switch very quickly into the government-run program. In addition, you'll have patients who are then treated by a system which involves significant rationing of care. There's nowhere in any government plan that exists, whether we look at Canada, whether we look at England, whether we look at Medicare or Medicaid, where rationing doesn't become a significant part of price controls. And with that comes wait lists and difficulty getting newer technology and newer items. And so we'll have a system where there'll be long waits, there'll be rationing, and it'll be something where patients actually lose choice because they're forced into the plan. Because as soon as the government plan grows, then there's going to be less patients in the private sector, and the prices of the private sector premiums are going to start to skyrocket as well. The way the public plan is being designed, there may be thousands of doctors who don't participate, and that is going to disrupt the relationship between the patient and the doctor and cause a lot of problems, both in terms of access, but also in terms of maintaining the health care and the quality that people currently have. If you look at the statistics about U.S. healthcare, 253 million Americans, over 80%, have health care that they like. They have a relationship with a physician that they like, and they want to maintain that. And so I think it's critical to fix what's broken in our healthcare system, and there are things that are broken. The issues of cost and the issues of access are critical, and those need to be fixed. But there's several ways that we can fix those without pitching the whole system to a socialized or single payer or public plan option. And the ways that you can do that is with tax credits, with things such as HSAs, with market-driven forces, with ideas such as vouchers for people who can't afford it. There's many things that can be done to fix the healthcare system and provide healthcare to those millions of Americans who don't have it. But those millions of Americans are really in the range of 10 to 20% of Americans. The other 80% have health care that they like, and so we need to fix the current system, and there's a lot of market force ways to do that.